Alright, let's dive into the first topic. Understanding the Varicella-Zoster virus and its effects on the human body. The Varicella-Zoster virus, or VZV for short, is a highly contagious virus that causes chickenpox. Chickenpox is an infection characterized by an itchy, blister-like rash that appears on the skin and typically lasts for about a week. Now, you might be wondering how this virus affects our bodies. When VZV enters our system, it usually starts by infecting the respiratory tract. From there, it spreads to the bloodstream and eventually to the skin. Once it reaches the skin, it begins to cause those infamous itchy blisters. These blisters can appear anywhere on the body and are often accompanied by other symptoms such as fever, fatigue, and a general feeling of discomfort. The Varicella-Zoster virus is quite sneaky, as it has the ability to remain dormant in our bodies even after the chickenpox infection has cleared up. This means that years later, the virus can reactivate and cause a different condition called shingles, which also presents with a painful rash. So to sum it up, the Varicella-Zoster virus is the culprit behind chickenpox, and it can have some pretty uncomfortable effects on our bodies, ranging from itchy blisters to more serious complications if not treated properly. Moving on to our second topic, let's discuss the transmission and contagiousness of chickenpox. Understanding how this virus spreads is crucial in preventing its transmission and keeping ourselves and those around us safe. Chickenpox is highly contagious, meaning it can spread quickly and easily from person to person. The primary mode of transmission is through the air. When someone with chickenpox coughs or sneezes, they release tiny droplets containing the virus into the air. Others nearby can then breathe in these droplets, leading to infection. This is why chickenpox can spread so rapidly in places like schools and childcare centers where children are in close contact with each other. In addition to airborne transmission, chickenpox can also spread through direct contact with an infected individual. Touching the fluid from a chickenpox blister, or coming into contact with contaminated items, such as clothing, or bedding, can also result in infection. It's important to note that chickenpox is most contagious during the first 2 to 5 days of illness, which is typically before the rash even appears. This means that people can unwillingly spread the virus before they realize they're infected. Furthermore, the contagious period continues until all the blisters have crusted over, which usually takes about a week. In short, chickenpox
is a highly contagious infection that spreads through the air in contact with infected individuals.
Being aware of these transmission methods can help us take appropriate precautions and reduce the risk of infection. Now let's move on to a third topic, recognizing the common symptoms and complications of chickenpox, as well as differentiating between mild and severe cases. Chickenpox usually begins with mild flu-like symptoms, such as fever, headache, and fatigue. These initial symptoms are often followed by the appearance of a red, itchy rash that develops into small, fluid-filled blisters. The rash typically starts on the face and torso before spreading to other parts of the body. It's important to note that the blisters can be extremely itchy, but scratching them can lead to scarring and an increased risk of bacterial infections. In most cases, chickenpox is a mild illness, and symptoms typically resolve within a week to 10 days. However, some individuals may experience more severe symptoms or complications. These can include high fever, dehydration, pneumonia, encephalitis, inflammation of the brain, or bacterial infections of the skin. Severe cases of chickenpox are more common in people with weakened immune systems, such as those with HIV, cancer, or those undergoing certain treatments like chemotherapy. To identify the difference between mild and severe cases, pay attention to the severity of the symptoms and how they progress. Mild cases usually involve a moderate rash, a low-grade fever, and general discomfort, while severe cases may involve a more extensive rash, high fever, and the presence of complications like pneumonia or encephalitis. In summary, recognizing the common symptoms of chickenpox and being able to differentiate between mild and severe cases is crucial in determining the appropriate course of action for treatment and managing potential complications. On to our fourth topic. Let's discuss the importance of vaccination in preventing chickenpox, with a focus on the varicella vaccine, its effectiveness, and potential side effects. Vaccination plays a crucial role in protecting against chickenpox and its complications. The varicella vaccine is specifically designed to protect against the Varicella-Zoster virus that causes chickenpox. It's typically given to children in 2 doses, with the first dose administered between 12 to 15 months, and the second dose between 4 to 6 years of age. The vaccine can also be given to older children and adults who haven't had chickenpox or been vaccinated before. The varicella vaccine is quite effective. Studies have shown that it's about 85 to 90% effective at preventing chickenpox altogether. Additionally, in cases where vaccinated individuals still contract chickenpox, the symptoms are usually milder and less severe. This means that the vaccine not only reduces the risk of getting chickenpox, but also helps minimize complications and severity if the infection does occur. Like any medical intervention, the varicella vaccine may have some potential side effects. However, most of these side effects are mild and short-lived. Common side effects include soreness or swelling at the injection site, mild fever, and a mild rash. Serious side effects are rare, but they can include severe allergic reactions or seizures. It's essential to discuss any concerns with your healthcare provider before getting vaccinated, especially if you have a history of severe allergies or other medical conditions. In conclusion, vaccination, particularly the varicella vaccine, is a vital tool in preventing chickenpox and reducing the severity of the infection. While some side effects may occur, they are generally mild, and the benefits of vaccination far outweigh the risks. Finally, let's explore our fifth topic: methods of treatment and management for chickenpox, including home remedies, medications, and isolation practices to prevent the spread of the virus. Since chickenpox is caused by a virus, there's no specific cure. However, there are several ways to manage the symptoms and prevent complications. Let's start with some home remedies. 1. To soothe itchiness, try applying calamine lotion, or taking a cool bath with added baking soda or colloidal oatmeal. Avoid hot baths, as they can make itching worse. And keep your nails short and clean to minimize the risk of bacterial infections from scratching. You can also cover your hands with gloves or socks, especially at night, to avoid scratching the blisters unconsciously. Simple. Stay hydrated by drinking plenty of water to help your body fight the infection and reduce the risk of dehydration caused by fever. In addition to these home remedies, medications can help manage symptoms. 1. Over-the-counter pain relievers and fever reducers, such as acetaminophen or ibuprofen, can help manage fever and discomfort. Avoid aspirin for children, as it can cause a rare but serious condition called Ray's syndrome. 2. Antihistamines, like diphenhydramine, can help alleviate itching and may also aid in sleep. 3. In some cases, your healthcare provider might prescribe antiviral medications, such as acyclovir, particularly for individuals at higher risk of complications. To prevent the spread of chickenpox, it's essential to practice isolation. 1. Keep the infected person away from others, especially pregnant individuals, newborn babies, and people with weakened immune systems, as they're more susceptible to severe complications. 2. Stay home from school, work, or any social gatherings until all the blisters have crusted over, which usually takes about a week. 3. Wash your hands frequently and avoid sharing personal items like towels, clothing, or bedding. In conclusion, managing chickenpox involves a combination of home remedies medications, and isolation practices. By following these measures, you can help alleviate symptoms, prevent complications, and reduce the spread of this highly contagious virus.